Yesterday, we brought you the story of the debate over the new walk-in clinic. Today, another medical center celebrated an open house, but for a different reason. The Blue Pine Clinic has been open for a year and a half, providing care to patients without a family doctor. It says it's all done in the name of quality care.
It was a picture-perfect day at the Blue Pine Clinic. It's been over a year since it opened, but now it's not just accepting referrals from the hospital.
And now we're kind of celebrating because we've just started taking referrals from various community agencies as well. So for us, this is kind of the last step in really making sure we're accessible to people in the community who don't have a doc and really do need that extra bit of care that we can give here.
What used to be known as the unattached patient clinic has morphed into a multi-doctor approach. It has 4 physicians, 3 nurse practitioners, as well as a social worker and a mental health clinician.
It's a team-based care approach. So the idea is that in-house, we've got a lot more services to help our patients than a GP's office would have.
Unlike a walk-in, a file will be started for a patient after he or she has been referred.
It's good to have them be able to call me. And if you're at a doctor's office, it's harder for them to call you because they have so many patients, right? And they just don't have the time. Where here, it's more of a comfortable situation.
Patients with chronic illnesses or multiple health issues will be transferred to the clinic where they'll receive more personalized care.
Well, it's important over time for a primary care provider, a doctor or a nurse practitioner to really know what's going on with the patient. You can't do that so well in a short encounter, but if you keep coming into the same practice over time, you really get to, both the patient gets to know the provider and the providers get to know the patient.
The Blue Pine Clinic is a part of the Division of Family Practices initiative to match people with longer-term care options. Thousands of people in Prince George still don't have a family doctor.
That's a sign of the times, and we definitely don't have enough physicians. Our Northern Medical Program's gone a long way to address that. We've got a long ways to go yet, but you know, places like this clinic and there's other opportunities that I see coming down the pipe here where people will have family doctors.
There are currently 700 patients at Blue Pine, but that number could grow now that they're accepting more referrals. Kelly Linehan, CKPG News.